The diagnosis I've always been given has been depression, psychotic depression, bipolar disorder, and I find them really hard to believe. I mean, I just find it really, you know, you have this idea, you have this idea of what patients will be like, I think, and what, you read about these things. I mean, they come up in literature and all sorts, and I just think, well, this, this doesn't happen to me or in my family, despite evidence to the contrary, and I just couldn't really accept it, and still find it very hard to accept. And I think one bit of me, I just about kind of think, well, I will accept this, and I will take the pills, because that's an important part of that, I've not always been very compliant with medication, which is, thought my psychiatrist certainly has thought that's a problem. But it's difficult to accept these things, and I think accepting it as a chronic illness. And I talk to people who I think almost are relieved or glad to get that diagnosis, because it makes sense of things or it validates them in some way, and that can be very important for them. I don't really feel particularly validated. I mean, I think if at the end of the day the first word that would come to my head would be fake about myself, even though another bit of me knows that that's just a bit silly, really. So I think I've always found it hard to accept. Yes, I think it's thrown up different things over the years. And one of the kind of first and foremost things, which can be quite tricky, is that I work in the Royal Edinburgh Hospital. I see my psychiatrist in the Royal Edinburgh Hospital, and these things can all happen very close together. That I'm working in the ward where I work, then I see my psychiatrist, then I go off and do a clinic, and that's quite. It just leaves you feeling not sure what you are. Are you the doctor? Are you the patient? It's easier to separate them, and I think I've tried to do that over the years. I mean, I try not to think about, having a psychiatric illness, particularly when I'm being a psychiatrist. Although maybe I have thought about it more in recent times, and I think that's maybe why I've written a bit more about it and talked a bit more about it. I think it's very difficult. I think there's the issue of what you would do as a psychiatrist and what you would expect as a patient. My own view is it's really important that it is all together, and that that we know about physical illnesses, and that's can be a problem at times, and that other doctors know about mental health problems. I think there is always still the putting it down to it being psychological. I know most people don't do that, but some do. And similarly, psychiatrists not picking up the physical. And I think that's an area which I feel strongly about, which I think we should come together a bit more in.